Welcome, everyone. My name is Katya Kletter. I'm brand director at Willo, and I want to introduce a couple of my colleagues and partners here who are going to talk about important topic around caring for special needs not parents, parents of special needs kids. And with that, I want to introduce Dr. Joel Berg, who is part of the Willow team, and Lisa Copeland, who will be talking about, who will be our interviewee. Lisa Copeland, she's an RDH CSP CVP, a number of certainly certifications behind you, and we're very happy to have you here. She's a healthcare expert, author, global expert, public speaking coach, and a passionate RDH with vast experience in the dental industry. And we're going to play a webinar that we recorded earlier this week. And just keep in mind that at the end of it, Lisa will be here to answer questions for everyone. So welcome, Lisa. We're happy to have you here.
Glad to be here.
No further ado, I'm going to...
Hi, I'm Joel Berg, Chief Dental Officer of Willow, and I'm really happy to be here today with Lisa Copeland. Lisa is a renowned and a leading authority in dental team communication and serves as the CEO of Communicate with Influence. Not only is she a Generation X professional, but she's also an accomplished author, Ironman, coach, and an international speaker. Her diverse global experience spans from the U.S. and Europe to Southeast Asia, enabling her to bring a wealth of firsthand knowledge to her coaching. Throughout her varied career, Lisa has held multiple roles within dental teams, a fact that amplifies her coaching efficacy and allows her to relate directly to her clients' challenges and triumphs. Dedicated to promoting optimized communication strategies, she passionately guides dental teams towards achieving heightened profitability and enhanced performance. Amongst her many achievements, Lisa holds the Distinguished CSP Award from the National Speakers Association, an honor bestowed upon fewer than 17% of speakers worldwide. Impressively, she stands as only one of 3 registered dental hygienists globally to have earned this esteemed accolade. Lisa, thanks so much for being with us here today.
Thank you. Thanks for having me. I always love talking with you, Joel.
Oh, likewise. I'm glad we have this opportunity today. So today we're going to talk about what we've called the care behind the smile, supporting special needs through everyday challenges. Let's start with the reality caregivers face. Why is toothbrushing such a common point of stress in families caring for loved ones with special needs?
Well, for many, it isn't just a task, right? It's sensory and it's emotional, and it quite often comes with physical hurdles as well. And so what takes one person 2 minutes, it seems like an eternity or an overwhelming experience for another.
Okay, so what are some of the specific biggest challenges, like traditional toothbrushing? So, we're talking today about this Willo automated toothbrush, which is solving some of the problems. What are those problems that it's solving? What are the biggest traditional challenges that one would see regarding manual or power brushes even?
Yeah, traditional brushing and most power toothbrushes, they require or demand a lot of coordination. And that's just not possible for some of our special needs patients, right? You can't, they're not able to turn their hands properly and cover all the surfaces of the teeth. And so using something like Willo, which we're going to talk about, I think, a little bit in depth more, it's automated. So it takes a lot of the guesswork and the physical disability out of using the toothbrush.
So I want to ask you, since I have a dental hygienist, quite accomplished dental hygienist at that, who communicates with other dental hygienists, you're used to telling patients all day long about either oral care. I often joke when I go to the dentist and the hygienist spends more time with me, I feel like I'm going to be shamed because I haven't flossed, or, you guys must have a course in shaming. I know
so.
It's not true. I joke about that. But the point is, it's tough to brush teeth, even for anybody, including adults, because, I remember that the teeth have different shapes and curvatures, and they're all different shapes. So even if you apply the same, even if you were to position on one tooth correctly, it's not going to be the same for the next tooth. It's a
Right.
different positioning.
Right.
So say something about that, if you would, please.
Well, it's got to be easy for a special needs patient to use any device, right? If they're really having to use a lot of coordination, they may not have the understanding or the ability to place the toothbrush in their mouth at the right angle and make the right motion, right? They just may not be able to do that. And so for every single special needs patient, you have to individualize the treatment, because what works for one isn't going to work for the other. And that's true even with our everyday patients. But even more specifically, we have to customize what we're recommending for them, because they have different triggers and they have different struggles.
I've known you, Lisa, for a long time, and you always have a great way of characterizing communication. And so you told me when we were talking about this, you talk a lot about brushing better. From brushing better, we tell our patients to brush better, to changing the experience. What does that mean for a caregiver, changing the experience?
It's all about creating a really calm and an empowering routine that removes the triggers, like the gag reflex and the sensory issues, and it removes the struggle. And so really it's about customizing individually for each person and finding the right device that's going to help them achieve better oral hygiene.
So the experience you're talking about is some kind of feedback that they realize they're doing it better, and it's not just because brush better sounds a little bit like shaming. You know what I mean? It sounds like you're not doing a good job.
Right.
But changing the experience has sort of a positive connotation, it reminds me of like motivational interviewing almost. You know what I mean? Where we're getting the patient to experience differently. You want them to change, so you're kind of working on them seeing it differently. Is that fair to say?
Changing their mindset, and also trying something new, right? Trying something different. And you hit the nail on the head with using something that's going to give them some feedback. So where are they in the process of brushing, and how many minutes do they have left, and when do they move the brush? And so that they have something to interact with that's going to keep them more engaged in the brushing cycle.
So let's talk a little bit more about special needs, and specifically helping neurodivergent or physically challenged individuals. How do we help them succeed with oral care? What can caregivers do? We as a preface to this, Lisa, before you respond, as a pediatric dentist myself, it's kind of ingrained in our souls that parents have to watch their kids brush. They have to watch them, have to observe them until they are 8 years old, when they can tie their own shoe. And of course, now that they all have Crocs, there's no shoes to tie anymore. So maybe they can never brush.
Crocs and
However,
Velcro.
Exactly. So, the thing I've always wondered about that mandate to parents watch the kids brush is, how does a parent know they're brushing correctly? You know what I mean? They may be watching them, but how do they know?
Well,
I don't know. That's
go ahead. Sorry.
As a rhetorical question, it's sort of.
Yeah. I think everybody needs a little guidance, but if you build a routine is going to build trust and confidence. And then when brushing happens at the same time, the same way, every single day, and routine is really important for our special needs patients, it builds or becomes predictability, and predictability reduces anxiety. And so it's a step-by-step process where they have to get feedback, right? So Willo Toothbrush gives patients feedback on their app, but they also have to have some kind of routine so that they know what they're doing at the same time in the same way every single day, because that predictability is really going to help reduce their anxiety. And so start small, make really small changes and give the patients some choices so that they are feeling more independent. I love that that Willo has a timer on it, because it helps them hold themselves accountable. Oh, okay, I'm
Yes.
halfway done. I need to switch the toothbrush, and now I'm going to continue, and I'm going to be done really fast.
Yeah. And I think all kids need that.
Yeah.
Kids with special needs as well. The feedback is as you know, is very important. What are some easy, practical ways that caregivers can reduce the resistance? Kids, we always think of it as kind of a struggle, resistance. The parents kind of, they don't get into actual fights, but it's sort of like, will you please brush your teeth and make sure? And it becomes this sort of like getting somebody to do something. They don't want to do it.
Right.
So, there are sensory triggers that could be altered. Tell us a little bit about that. Some of your thoughts.
Well, it's all about figuring out what's going to work for that individual. But if you can relieve or reduce some of the triggers, like with special needs patients, some of the biggest triggers are gag reflex or sensory issues, or they don't like the noise or the sound specifically, or too much toothpaste, right? There's a lot of things that can really trigger them. And so if we use a device like Willo, it eliminates or removes a lot of the triggers. And so it's a much more pleasant experience for the patient. And then in turn, because you're not having that constant tug of war, it gives the care provider a little bit of a breathing time or breathing room.
Okay. So you mentioned Willo. So tell us how Willo is different from traditional toothbrushes. How does it specifically support patients with special needs based on what you've told us about patients with special needs?
Yeah, what I love about it is it doesn't rely on technique like a manual toothbrush, right? It's automated, it's sensory friendly, and it's very consistent. You're going to get the same result because of the way that it works. So the patient just has to place it in their mouth, put their lips around it, and the toothbrush does the work for them. And so there's not as much manual dexterity involved. It reduces a lot of the frustration. And what I think it does is it meets the patients where they're at, or the users where they're at, and not where they're expected to be.
So one of the benefits you mentioned that Willow's promoting this, I would call it independence.
Mm-hmm.
That, like I was saying earlier, that we say that parents have to observe. This perhaps makes them more independent. Why is that so impactful for both the child, the user, and the caregiver?
Independence is huge for special needs patients and our loved ones. It gives them a sense of value. And when somebody can take ownership of their own routine, even in just a very, very small way, it's going to build dignity and it's going to build confidence for them. And like I mentioned earlier, when that happens, you also have the caregiver gets a minute to breathe, right? It's a win-win.
Oh, yeah, definitely. You have an example? Could you tell us cases or examples about that?
Oh, yeah. I had this patient this was many years ago, and I was working in Washington, D.C., and her grandfather was her caregiver. And he would bring her in. She was in about her 20s, but she had a mentality of about a 6-year-old. And he would bring her in, and it was just a struggle. She just hated brushing her teeth. And we would have a conversation. She was in the room, and I would have a conversation with her grandpa, and he would say, every night and every morning it ends in tears for both of us. And we'd have a little giggle about that. But he said, we've tried so many variations of manual and power toothbrushes, but she just couldn't handle the sensory aspect. She was very, very sensitive to, even when I was polishing her teeth. And I wish that I still was in touch with them, because I think Willo would be the one that she would be able to handle, because it does remove so many of those triggers, like the sensory issue that she had.
Yeah. Well, I think your words are going to influence many dental hygienists who are seeing those patients today, and will influence them exactly like you wish you could have then. So I'm certain of that. So for caregivers who are skeptical, aren't like tech oriented, overwhelmed by new ideas, what would you say to them to make them sort of confident to at least try Willo?
You're not alone. You're not alone, and you don't have to go it alone. Trying something new for all of us can feel really scary, but if it works, it's life-changing. And this is one of the true oral hygiene devices that I think is going to be life-changing for so many of our special needs patients.
Wow. I can't wait to put your words in front of all the dental hygienists in the world. We will. So if there is one takeaway that you hope listeners walk away with about Willo and special needs patients specifically, what would that be?
I think oral care doesn't have to be a battle. With the right tools and the right support, it can be simple and it can be empowering and it can be even joyful for not only the caregiver, but also the patient.
Well, those are words of wisdom, I think, because you've had the experience in all aspects as a communicator, as a practitioner, in so many aspects of dentistry. And you've written a book about this, about communication, Communicate with Influence. I'm not here to promote your book, but I've read it and it's excellent.
Thank you.
And you know, you talk about, we don't talk enough about communicating in the dental office. So when you think about everything you said today, it's really about communicating with that parent, that moment. And as I always say, and I think you'll agree with me, when that mom comes in with that, and it's usually the mom, you know, with the caregiver, with the child, the only thing that she cares about is her child.
Right.
And they come to us and they spend way more time with the hygienist or the assistant, depending on the case, than they do with me. So it's like an amazing opportunity to share this new ideas and technology. And I think your words today are going to inspire many to spread the right message and communicate effectively. So
Oh, I
thank
hope
you for being
so.
with us
I
today.
really believe it's a game changer in the dental toothbrush industry.
Thank you, Lisa, for being with us today.
Thanks, Joel.
I want to thank Dr. Berg, who I see is actually on the line as well, and Elisa for this interview. Very important insights. And Lisa, I love what you were, the example that you gave with the patient that you saw, saying, hey, or the grandpa saying every night and every morning, it ends in tears. Such a common experience that we hear from parents, especially parents with special needs, that we hear over and over again. And as you said, oral care doesn't have to be a battle. So thank you for sharing your insights. Thank you for being here with us.
You're
And
welcome.
I want to open it for questions from our audience. Either type or if you raise your hand, I will open the line for you. And I have a few questions, maybe one question that came in, I see. So Lisa, we know parents can struggle to establish a routine with kids who have special needs. What tips do you have for positively engaging caregivers to establish an oral care routine? How can we help them in that regard?
Mm-hmm. Start really small and keep it really, really consistent. The routines are super powerful with our special needs patients. So same time, same place, same bat channel. I always say I age myself with that one. But the same sequence over and over every single day, you know, morning and night. Also using visual schedules and timers and reward charts and apps. They're going to create that predictability that's going to increase their success as well. And then also remember to celebrate progress, not perfection, because that is really meaningful to a special needs person. You know, the little things we've got to pay attention to and celebrate. Perfection is our enemy when it comes to making progress.
Yes, yes, indeed. And I think predictability and routine are important for all of
Mhm.
us. But yeah, as you said, especially for the special needs patient. I have one more question that I see. How can we manage potentially challenging behaviors during the dental appointment?
Support in the dental chair starts with empathy, right? And we have to offer them tools that we know are going to give them a little bit of independence. But first, we have to take a step back and figure out what works for that particular patient, right? What are the challenges that they're facing? Is it sensory? Is it a gag reflex? Is it dexterity? You know, all of these come into play with our special needs patients, and we've got to figure that out first before we can really move forward to figure out what devices might work best for them. Even small steps, recognizing them, are going to build confidence for them.
Thank you. I'm gonna wait for Any other questions? I have one more that is coming. Where can people purchase Willo?
You can get Willo directly through Willo and also through Amazon.
Yep. And we're actually, just to add to this, we're working on potential program where we can dispense Willo through dental offices. So if anyone on the line is interested in that, please contact our support number. We would love to talk to you about potentially next steps on that.
That's great.
Any other questions from anyone on the line? All right. Well, maybe in closing, can you, Lisa, can you one more time tell us why Willow is a good choice for children with sensory sensitivities?
Oh gosh, so many things, but to sum it up, it's automated. It really it does the work for them. It's the first automated toothbrush that they don't have to have the manual dexterity. They don't have to have the knowledge of moving the brush around like most power toothbrushes or manual toothbrushes. It gives them comfort, control, and independence. I think the most important part of what I just said is it gives them independence. They can take ownership of their routine. And that's huge for children and also special needs children and patients, because independence creates a self of well-being and really initiates a change in personality, and the mentality of the task changes as well. So I think the independence is one of the best things that Willo is providing for them.
Thank you. Thank you, Lisa. It's so great to have you here with us and to have your support and endorsement of Willo. Having dental professionals certainly experience Willo, understand the benefits that it provides for their patients, whether it be any kid or particularly the special needs kids that you see in the office. Understanding the benefits of it is so very important for us, and we have focused a lot of our efforts in not only driving awareness but also the clinical support behind it, to make sure that we share certainly all the work that went behind the development of the product and why it is a good choice for children out there.
Yep. Thank you
Thank
so
you.
much for having me. I enjoyed presenting the information, and I'm so looking forward to the success of Willo, because I really do think it's a game changer.
Thank you. Thank you, Lisa. And thank you
Thanks.
everyone that joined us tonight.